Good morning. Welcome to the Carbondale Desert Clinic. What brings you here today?
Oh, hey, dude, I'm bleeding a lot. I need to see a doctor. Are you a secretary or a doctor?
I'm not a secretary. I'm a PA. Why does everyone always think I'm a secretary? PAs are medical clinicians. We are not secretaries. And while I may not be a doctor, I am able to handle whatever problem you are having right now. And if I am not, there's always a doctor available.
Dude, I did not mean to offend you. Listen up, I know what a PA is. I just didn't know why a PA is at the front desk instead of seeing patients. Everybody knows a PA is a very capable and competent medical clinician.
Really?
That's right, my man. You should have more confidence. Listen up, bro. When you have PAC after your name, oh, BTW, all of y'all out there can follow along on the PowerPoint handouts. But dude, when you have PAC after your name, your patient can trust you have graduated from a program that complies with the ARC-PA's accreditation process for PA programs, a process that tells the healthcare industry and your patients that you graduated from a program that has met nationally accepted qualifications and educational standards for your field. Am I wrong?
No.
Am I wrong?
No.
No, I'm not wrong. And dude, when you have PAC after your name, your patient can trust you have passed the Physician Assistant National Certifying Exam, a challenging assessment of medical and surgical knowledge. They can trust that you maintain and continuously improve and update your knowledge with mandatory continuing medical education and testing for recertification every 10 years. Am I lying?
No.
Am I lying? Tell me if I'm lying to you right now.
No, you're not lying. I graduated from an accredited program, and I passed the PANCE for certification. If I hadn't done that, I couldn't call myself a PA with a C after it. We have to keep up with continuing education requirements and stay up to date on changes and standards of healthcare. And every few years, certified PAs have to take a test again to stay certified. I have to take that test every 6 years. These here jokers will take it every 10. But yeah, you're not lying.
No, I'm not lying. And when you have PAC after your name, in most states, your patient can trust you have been licensed by your state's licensing board, usually composed of practicing PAs and the practicing physicians who employ and work with PAs. It is in their best interest and yours that only well-qualified and highly competent PAs are practicing in your state. You know that's right.
It's true. All states have enacted laws regulating the practice of physician assistants, and there are licensing boards in about 43 states and the District of Columbia.
You ain't telling me nothing I don't know already. Everybody in this room right now knows how much a physician assistant goes through to do that job. When you have PAC after your name, your patient can trust you. Listen, I don't want to be a complainer, but I'm feeling a little woozy here.
Oh yes, that's right. You've been stabbed a little there in your back, haven't you?
See, you are an astute diagnostician.
You know what they say, healthcare is a 2-inch sword. It cuts both ways, but not very deeply. But that's not the case here. You've been stabbed quite deeply, really.
Yes, I think the sharp part is actually poking out my chest a little here.
Yes, I believe you are right. I'm going to call the doctor now if you don't mind.
Yes, please. Pop quiz. Tell me what risk management means to you.
You should probably lie down or something. So much blood. So much blood that is on the wrong side of your vessel walls.
I'll be fine. While we wait for a doctor, it is pop quiz time. Pop quiz, what is risk management?
Risk management means common sense strategies that can prevent medical liability exposure, including documentation of everything that you do to the patient, maintaining confidentiality and professionalism, dictation of medical information, writing legibly, and using the correct method for correcting mistakes and documentation.
See, you know what you are talking about. Dictating for transcription has been very beneficial for making sure you keep accurate records. When you use good handwriting, that's helpful too.
And maybe the most important thing I do is establish consistent methods of charting and organizing. If everything is methodical, it's a lot easier to keep from missing anything. As a matter of fact, I began the inspection part of the physical exam the moment you walk in the door. Because of my methodology, I assess that you are bleeding very heavily from your wounds.
I know. You're a professional, dude. That's an astute observation. Judging by this puddle on the floor, I actually have very little blood left in my body. Okay, pop quiz number dose. What is quality assurance?
Quality assurance. That's when we make every effort to continually improve the quality of care and service we deliver. We use what we call performance measures to pinpoint our strengths and our opportunities for improvement. We look at things like the quality of care we provide, the satisfaction of our patients, and cost-effective use of resources and facilities.
Pop quiz numero 3. Tell me about the witness that never fades.
You were talking about documentation.
That's right. Documentation. The witness that never fades.
Documentation. The medical record is a legal document of everything you're doing to the patient and everything you have already done for the patient. It shall give an accurate and clear picture of all care given. SOAP notes have been a valuable tool in achieving this. Subjective, objective, assessment, and plan. Some use what they call SOAP per notes, adding on what patient education was given, and adding on the patient's response, assuring that the patient understands the treatment plan and instructions.
See, you know your stuff. I bet you know a thing or two about actually practicing medicine too.
Hey, have you ever been here before?
No, this is my first time. I was just outside here when I started having a knife in my back, so I just dropped in to see what condition my condition was in.
Well, you should probably see the doctor. He's a good man and thorough. But for now, I'm going to do a complete history and physical so I can charge you as much as possible. I'm just kidding. We only get reimbursed 85% if it's your first time here and you see a PA instead of the doctor. I'll charge it under my own provider number. If you'd been here before and seen the doctor, this would be kind of a follow-up of that. And I could use the doctor's provider number and charge 100%, using what they call an incident to your previous visit.
Well, that sure sounds like a bargain. Can we go ahead and get that history and physical done so I can go see that doctor while I still have enough red blood cells to keep my tissues perfused? I think I am technically a zombie at this point.
Don't eat my face. Ha 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 ha.
Ha 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 ha.
Ha 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 ha.
I'm going to lie down for a while.
Umbilicus.